Welcome to Man Up, where our guest host today will be Dr. Zane Gates, and we'll have a conversation on how Gloria Gates Care is transforming healthcare.
Man Up is a series that challenges men to become strong, unique, discipled followers of Jesus. Hosts Troy Ferguson, Brent Zimmerman, and Victor Thomas. Welcome to Man Up.
Happy New Year to all our audience and viewers out there. Did you know that the most celebrated holiday in America is not Christmas, it's actually New Year's Day? I broke down some statistics from the website yougov.com that says the top 10 resolutions are this. Americans every year, they want to lose weight, save money, get physically fit, eat healthy, learn something new, drink less alcohol, quit smoking, reduce stress, get more sleep, travel more. Did you know that 40% of those people actually keep those resolutions for about 20 days? About 75% of them break the resolutions by the time Valentine's Day rolls around. The Apostle Paul gives us some confidence writing in Philippians 3:13. He gives us some surprising evidence considering he's in a prison at the time. And he says the best way to overcome that is to let go of the past. Let go of the past. So the Apostle Paul wrote, many people tend to celebrate the survival of the old year instead of celebrating the new year. I can relate to a time when I was young and maybe I fell and I skinned my knee, and you've probably been through that before. Over a period of time, there's a scab that's going to come and come over that wound. And I'll never forget one of my parents or my grandparent telling me, Victor, stop picking at that scab. If you don't pick at it, if you continue to pick at it, it's not going to heal. We need to take a note from that. Many folks, Christians, people, we need to let go of our past and look forward to the future. Your mistakes are your mistakes. There's no sense reliving them. You lived them, you experienced them. Some of them brought on you, some of them self-inflicted. But it's time to let go. It's time to let that healing process go and move on to the next step. Some adults, even those of us in the church who are Bible believers, faith-walking, scripture-quoting Christians, need to learn how to let go of the past. Embrace the new. There's a joy that comes with the new. Take no thought for the old, and let's move on to the new. It says in the scripture, weeping may endure for one night, but joy comes in the morning. I propose this is what you do. Let go of the past and take hold of the new. Stay tuned for this edition of Man Up.
When it's time for a new roof, Champion Roofing is your best choice. We're a certified award-winning roofing contractor, meaning your roof is done right the first time. Call today.
Champion Roofing, we're the solution.
Welcome back. We have with us Dr. Gates.
Hey, thanks for having me.
Hey, I have to say this right from the beginning. Apologize to the audience in case I call you Zane, because I've known you all my life, so I might slip. And you're deserving of the title doctor, so I don't want to shorten you in that respect. I remember the last time you were here, Pastor Jim had said your name, Zane, means gift of God. Gift of God. And you truly are that with what you're doing, with your industry. And we're hoping you could tell us a little about yourself and tell us about how Gloria Gates is transforming healthcare.
Well, it all stems from the name, Gloria Gates. My mom, as you know, I played baseball with your brother, and he met my mom many times. And she had the wrong card, the wrong medical card. When I was in medical school, and I was only 22 years old, if you had different coverage, you could go to Pittsburgh and get a new procedure at the time. It was called tissue plasma activator, TPA. And catheterizations that would have really not allowed her to have the heart attack, survive the heart attack. So she died 6 months later in my first semester of medical school. And I promised to her as I was, holding her hand as she was dying that, that I would never ever let this happen to anybody else. And it's kind of fueled my career. And so first I started the free clinic which Senate Bill number 5 helped. That was many years ago. It took me 5 years to pass, and I learned, boy, government's tough. Because after I passed it, and it was great, then they defunded it. So after that, I knew that the only way I was really going to be able to help people was grants and charity. It's something this big and this big of an industry. You know, you really have to have a financial model and an economic model. And the biggest problem was there's too many middlemen in healthcare that take away from the care. We spend $1.6 trillion a year on the middleman.
Wow. On the middleman.
That's more money than the entire car industry. That's more money than the entertainment industry, including sports. And it's 8 times more than any country. Not the amount, but it's 8 times more as a percent of GDP than any other country in the world. And that's why we're ranked last. And just look at the top 25 Fortune 500 companies. Six of them out of the 25 are bigger than, are all healthcare administration companies, middlemen. They're bigger than, United and Aetna are bigger than Microsoft, Exxon Valdez, JP Morgan Chase, and yet you don't get the people who are providing the care until you get the whole way down to in the 60s and 70s. So that's the disconnect. So by doing that, now, by directly engaging with the insurance company without any of the middlemen and things like that, and providing better care and managing people better, especially those in need, which cost insurance companies an awful lot of money, we were able to build a model to take care of people the way they really should be taken care of. And I'm telling you, everyone wants to beat up the providers, the doctors, and nurse practitioners. Like, man, he didn't spend. What they are under now, and the pressure that they under, is extreme with all the administration. So that's our mission, to really give the care back to the health professionals so they can really give it back to the people.
You know, it's interesting. I would never have guessed, just as a person on the outside, you look at cost and this and that, I would never have guessed the amount of money that is, in a sense, being wasted on the middleman. It's amazing. So let me ask you a question. A recent article on the Gloria Gates Facebook page said, the majority of Americans don't seek health care because of the high cost of premiums, co-pays, and deductibles imposed by the insurance industry. Can you speak a little bit on that?
Well, the reason why is because insurance was never designed to do what we're asking it to do. Imagine if we treated car insurance like we treated health insurance, where you'd insure brake pads and oil changes. You know, the cost of oil changes would go up astronomically. So the only way insurance companies can keep premiums down is to stop people from using it, not get them healthier. Stop them from using it. Co-pays, deductibles, co-insurance. I mean, you go to the doctors, you have no idea what it costs or what it's gonna cost, and if the cost is real. And that's the biggest problem, and that's not going to get better. What we do is, by taking all the things you know you're gonna need, primary care, all your labs in radiology, cardiology testing, pulmonary testing, some orthopedic durable medical equipment, psych, physical therapy. Everybody needs these at some point. Everybody always sprains something. Everybody always gets a cold. You're always going to need a generic medication. You know, most Americans have a chronic disease of some sort, whether it be mild. Lots of mental illness that's gone untreated. These things shouldn't be in an insurance model. You should buy them in a membership model, and that's what we did. The insurance companies work with us in a membership model way, and it takes away all the co-pays and deductibles, because the incentive now is to get people healthier. And with the, you know, we deal mostly with a lot of the lower income individuals. Healthcare is just a small part of it. Food insecurity, education, transportation. These things are just as important as healthcare. To give you one powerful statement, in Western Pennsylvania, the average lifespan of an African American is poor African American 67, a poor white 70, middle class is 78, and wealthy is 83 to 84. Forget health care. If you simply take somebody that's poor and gives them the opportunity through education stuff and make them middle class, you increase their life expectancy by 11 years.
Hey, you brought up a lot of good points about the problems with healthcare. So let me ask you a couple questions here real quick. Understaffing, we know, is a problem. Being affordable, out-of-pocket expenses. Tell us how Gloria Gates Healthcare helps those issues or helps resolve or eliminate those problems with healthcare. What do you guys bring to the table for that?
When you disintermediate all the middlemen, that allows you to hire more people, that allows you to provide more care. There's $1.6 trillion out there in administration costs that could be used to put into care. So we start the beginning by disintermediating the media. Now the doctors can spend more time. The nurses can do more things. We have a pharmacist, we have a clinical dietitian.
Dr. Zane, not to interrupt you, but explain a little bit more on the middleman, because I think most people don't quite understand that. Who is that?
So first, the most important people are health insurance brokers. They for employer-based, and then they have to have a large staff. And then you have third-party payers that pay the bills. Then you have actuaries. Then you have that have to calculate what your risk is. Then you have something called, the most controversial of them is prescription benefit managers. They don't exist anywhere else in the world. They don't exist anywhere else in the world.
So with Gloria Gates, we're dealing directly with Gloria Gates Health.
Yes, for their generic prescriptions. For the branded name, Congress now is starting to go after them because, the profits are extreme, and it's taken away from patient care. Most people in that industry make a lot more money than people on the care side. And it's true.
I know we're running short on time, and we may even want to continue some of this in our next segment.
Sure.
It's good stuff. But I know as a pastor, I hear people struggle with finances, and they got to make decisions to pay their rent or buy medication, to pay their light bill or buy medication.
Or eat.
Yeah. So how do you feel that Gloria Gates can change that ongoing issue in our culture?
By finding where people fit in the healthcare spectrum by their income. Some people qualify for Medicaid. They don't know it. It's so complicated to get it. If you have one mistake on the application, you get kicked off. Victor, you've lived that 1,000 times. If you're, more in the lower middle class, you qualify for an Affordable Care Act in the exchanges. If you're too far out and it's way too expensive for the premiums, we have just a basic plan called WOW Care, Wings of Wellness, that provides. It doesn't cover if you go to the hospital or anything like that, but you can get a high deductible plan, and all those services that I talked to you about have no co-pays and no deductibles. So those are the ones that keep you out of the hospital. See, we've got it all wrong. We look at your health care as insurance against going to the hospital. Well, that's too late. Your diabetes you've had for a long time, you're not treated. Your high blood pressure, your depression. People underestimate mental illness. Mental illness is, they think it's like a sign of weakness. It's a sign of, no, most of the time it's a genetic chemical imbalance, just like diabetes, just like thyroid disease. And we lose empathy and understanding for these folks. And that's why we have a lot of these tragedies that are going around, because we make those people feel bad. Same with substance use. We make them feel like they're less, and it's a weakness. And they're sick.
Yeah.
They need empathy, man. And that's what the problem is.
That is real good. Hey, can you stick around for the next segment?
Yeah.
I'd like to continue this conversation. We'll be back in just a minute.
This segment is brought to you by Harry's Construction, whose motto is, "If you can dream it, we can create it." They are the kitchen and bath design experts, so call Harry's Construction for all your remodeling needs.
Welcome back. Brent, I believe there's some follow-up questions you have for Dr. Gates.
Absolutely. So Dr. Gates, help me understand this a little bit better. Who is this healthcare for? Is that for the average person? And what about people like me who I'm an employer and I have employees? What could you guys do for me and my company or for my people?
Well, we can't actually start getting into the employer market due to our old contract with my old company, but we can help employers get their people covered. Most people don't know that you can make up to $35,000 a year if you have medical conditions and qualify for Medicaid. For the ACA, we're on Geisinger plans, and we also have a path that you can buy a high deductible. Like if you make $35,000 to $40,000, you can buy a high deductible UPMC plan and buy one of our Wings of Wellness, and you have full coverage. Now, by no means am I a broker or have a broker's license. We can talk about healthcare benefits, but I can tell you generalities of how it really works to get. So these are some of the generalities that you qualify for a lot. You just have to come in and see. Most people qualify for something. As long as we can get you in and get you, let's say you have a catastrophic plan, and it's scary because it's a $6,700 deductible. But if you have us underneath you, you have all those services with no copays and no deductibles. If anybody purchases a Geisinger plan, of any sort, and comes to our place, they have no copays and no deductibles.
Wow, that's some good information. A lot of people don't know that.
Yeah. So yeah, they just have to really just give us a call, because when you come in, it's like a suit, like getting measured for your suit, because we got to find out what your healthcare needs, what you need. Because what we do different is, instead of people design the insurance first, then design the care around it, we design the care first, then fill in gaps to know how much risk. Because really, people are only buying coverage for the chance that God forbid I have a stroke and blah, 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 blah. And they don't think about that. Anybody under the age of 65 has a 4% chance that they're going to spend more than $10,000 in a year, right? Wow. And everybody buys that risk. They're buying for that. So it's economically infeasible to pay the average premium per employee in this country around $10,000. So would you pay $10,000 for a 4% chance you might use more? Sure. It doesn't economically feasible. So you're better off having a little. If you have a reserve somewhere of $6,700 that you could pay over time, right? It's good for you to buy a plan like this, because you're most likely going to need at some point an MRI or a CAT scan. And in most plans, as you look, you're paying out of your pocket a bunch for that. Yeah. So you're buying for the chance that lightning will strike, instead of buying for the chance that you might hurt your back real bad and need physical therapy. Which one's more likely? Sure. Yeah, and if you're getting your cholesterol medicine and you're getting your diabetic medicine like free, that's going to prevent you from doing all these other things. And if you're unfortunate for that to happen, you can plan for that. People buy cars that are, people buy. If I tell you to think differently, because everybody thinks about their healthcare coverage like, well, that's going to 100% happen. I got that $6,700 deductible. Oh my God, I can't live with that. I got to get that deductible down and pay so much more premium, right? But you're not thinking logic. Look, buy all the stuff you most likely are going to use for sure, and then insure the risk, and know that the worst thing that can happen to me is $6,700, right? If a family, $15,000, but that's the worst thing that could happen to me, and plan for it. We do it with everything else. We do it with our vehicles. We do it with all our other stuff, and it may not happen. But I'd rather pay for the definite and have a maybe, instead of paying for the maybe and then paying for the definite. That's what we're doing. So that's how we approach
a lot of good information.
to buying healthcare. How about buy healthcare and not buy insurance? Have insurance for risk and know what risk you could tolerate. Hey man, I don't have that much money. I can't afford $6,700. It's not like the hospital says we want you to write that $6,700 now. They'll let you pay it over time.
Right.
You set up a payment plan with them. They want to work with you. They want their money,
Yeah.
and they'd rather get it.
Yes.
And they know you can't get water from a rock.
Sure.
I can't write you a $6,700 check, but I can give you payments,
Sure.
or I have $3,000 and I can give you payments for the rest, right?
Yeah.
On the 4% chance that that might happen.
Right.
Now you have the right mindset about your health care.
Yeah.
Quit buying insurance. I don't know. Anybody go to the Highmark building if you have chest pain? No. You go to the hospital,
right?
But that's the way we think of it. Healthcare.
You know, Dr. Gates, when Donnie Beaver was here, he and I chatted, and I actually took a tour of your facility locally here in Altoona. And first of all, I'd like to hear about the expansion beyond our area. But one of the things that I remember him talking to me about was one-stop shop, in a sense. When someone comes to your facility, that's the only building they need to go to, or something similar to that. Talk a little bit about that.
Well, right now we're in the process of putting everything in that building, because that's a heavy lift. But we're almost there.
Sure.
But in the interim, we've got 611 MRI. That's who we use to take care of all our radiological needs. We have a full lab service. We have our own physical therapies. If you need cardiology testing, we send you over to cardiology associates until we have it all in our building. Everything's all set up to go. We just have to put the equipment in, and that's going to take 2 to 3 months to have that all
What's
done.
the concept of having that all in-house?
Time. Time is expensive to people. And we've gotten, in healthcare, we've gotten so skewed in that people's time isn't valuable, because it is. And I don't blame any of the other practices, because they are getting, if people could understand how bad it is for these folks and for hospitals. Everybody wants to beat these guys up, but they're frank, there is no money. And people's time is important. Having everything in one place with no prior authorizations. You heard that terrible thing that happened in deny. United Healthcare, 36% denial rate, all these things and all. There is no deny in there. If you need a CAT scan, you get it. If you need a stress test, I'll give you a great story. Guy came in, this was probably 5 years ago. He was shoveling, and he said to his wife, "Hey, my heart was really beating, it was weird." And he comes to our office. Now, he didn't have any chest pain, but he had symptoms that needed workup. If he was on the traditional insurance, he'd had to get a prior authorization, and he'd have waited 3 to 4 days. We had him in the stress test the next day, and something really bad happened to him. And he was fine because there were doctors and everything around this person, and he did absolutely very, very well. And if it would have been in traditional service, if he waited 3 days, something really bad would have happened to this poor guy. And those are the stories day after day of people dying waiting to get tests. We can avoid that because of our partners, and very soon it'll all be in one place, and we will control that experience. If I look at you, boy, I can get this guy. Just for instance, I've had patients come in and I needed a lab on them, and instead of them having to go, us draw the blood, we were able to do the lab right away, and I could tell, well, this guy needs to go to the hospital or he doesn't need to go to the hospital. Delay in treatment is just as bad as, at times, as no treatment.
Right.
Makes sense.
So that's where we're able to really, really move the needle in and people's time. You have to run over here to do this, you have to run over here to do that, but still, 611 is not far. We provide transportation, and very soon, in the next 3 to 4 months, we'll have most of that stuff. Unless there's a hitch, there's always hitches and constructions and stuff like that. All the stuff will be in one place or close to one place.
Now, let me ask this with the time we have remaining. Opened in January, the clinic, and yesterday I heard the CEO speak about the growth. Could you speak to that, the contractual obligations you have with Geisinger and UPMC and the growth that you want to expand?
Well, right now, we're adding about 20 to 35 new patients every single day.
Wow.
And that's thanks to guys like Victor, and
Yeah.
who's doing an amazing job for us.
Thank you.
And we plan this model, by the grace of God. I'm not that smart. The Holy Spirit is. No, I'm telling
Well,
you
you're
guys.
a doctor. You got to.
No, I'm smart, but all this stuff that happens is from the Holy Spirit.
Amen.
Yeah.
That's
100%.
See the hand of God in it for sure.
There's the hand. It is the hand. I'm just a mere vessel for this.
That's right.
You're just hearing the message.
Right.
Gift.
But what I'm telling you, this needs to go everywhere. This solves the problem, the broken problem of decoupling insurance and care. You get the care, and you need the insurance when it's economically not feasible for you to pay that. That's why you pay $1,000 or $600 a year on a $35,000, $40,000 car. It's economically feasible. That's what we want to create, and it could save. And I am sure, because the math is the math, it could save the American healthcare system.
Wow. Wow.
As you had mentioned, I partner with you. I'm there with you, Gloria Gates, and we want to close this segment out. Every place I go, I hear Dr. Gates has given back to the community. Could you briefly, in the last 30 seconds, speak to what motivated you to want to give back to this community?
Because that's all my mother ever did. And she had nothing. My mom was a single mom in a housing project with an 8th grade education who walked to work with broken shoes and never had any new, but all I ever saw her do is help other people. And I was like, man, Mom, we're pulling when we first moved, we didn't have furniture, so we pulled it out of a garbage can. And I'm sitting there thinking, she had nothing, and she's the happiest person on this planet.
Wow.
And she was we were Catholic, and we are Catholic, and she was the happiest person in the world because she died healthy, because she spent her entire life helping people. I see people die, unfortunately, as my job all the time. And I can tell you, they don't think about how much money I made. I've seen CEOs die, I've seen homeless die. All they care about is, what have I done with my life? Whose life I changed and who I've loved. And that's all that's ever mattered.
Good stuff.
Thank you so much for joining us. We got to end there. We could go on, but thank you for joining us here today. And we want to thank our guest for taking away from his busy schedule. Have a happy New Year.
Next time on Man Up, we'll have my good friend Josh Kirksey. We'll be talking about supporting your pastor.
I would say since 2002, 2003 time period, my wife and I just were served in multiple different roles. We're student pastors, worship leader, all the above and things like that. And now we are the lead pastors of a church here in the area, Williamsburg, PA, Grace Point Community Church.
All that and more next time on Man Up. When it's time for a new roof, Champion Roofing is your best choice. We're a certified award-winning roofing contractor, meaning your roof is done right the first time. Call today.
Champion Roofing, we're the solution.